Maybe we'll start. I know some people will be joining us as we go. And there's still one panelist who's still about to join us. But I'm Mark Van Marion. I'm with the Global Alliance for Improved Nutrition. And let me welcome you to this session on food fortification. Particularly welcome those who are taking off their holiday here in Geneva to come. Thank you for doing that. And at the end of the World Health Assembly, where many people are tired. But I think it's really important that we are having this discussion here at the World Health Assembly and integrating nutrition into the big discussions that we're having this year around nutrition and development, which, as many of you know, this is such a pivotal year for the global community with the ending of the MDGs and the new SDGs, or Sustainable Development Goals, being finalized. And it's important also because there still is a lot of debate about what will be in those Sustainable Development Goals. But so far we do see a major focus on food and nutrition as a major priority. And that's important because the Millennium Development Goals really did not, other than an MDG1, did not put a big focus on, an explicit focus, as many of us would have liked, on nutrition. But as a lot of people in this room would already be aware, nutrition and food security are really still fundamental problems that we face as a global community. If we just look at micronutrient deficiencies alone, we are talking over 2 billion people in the world still suffering from micronutrient deficiencies. That's 1 in every 3 people on the planet. So I'm not going to talk about all the other aspects of malnutrition, which many of you know from stunting to overweight and obesity, but I really want to mainly focus on micronutrient deficiencies and hidden hunger. And as some of you are certainly aware, that there are many interventions and many different ways to tackle hidden hunger, and we have been using these for a number of decades, everything from supplementation to ensuring that people have access to an affordable, healthy, and diverse diet. But the reality is that many parts of the world still do not have access to a food system that provides them with healthy foods and a diverse diet. And this is why we still need to look towards other ways of bringing and providing access to vitamin and minerals and bringing those into the diet. And in a sense, adding to the food system because of the absence of the food system being able to provide these on a regular basis. And so what we also need to be looking at is we need to reach large numbers of the population. It's not reaching 500,000 people is not going to solve micronutrient deficiencies in the world. So this kind of challenge needs us to look for some interventions that really work. And what we're going to talk about today is really large-scale food fortification, which is really one of the most effective strategies we have to address micronutrient deficiencies, by essentially adding vitamin and minerals into the processing of staple foods and condiments. This is a technology that has been around for over 100 years. It's certainly in the rich countries has been used quite effectively for the last 75 years, and really in poor countries, it's really over the last 25, 30 years that it started to be rolled out. And it is one of the one of the safest interventions that we have. It does allow, it works on a population base, so we are reaching the whole population, but our focus really is to try and ensure that we reach women and children through this total population approach. And I think it's important to note it's one of the very few global health interventions that is sustainable, meaning that it does get picked up by the market, that does cover most of the recurring cost, which is something that we don't have. But it also is an intervention that no one sector can deliver this on its own. It does need all parts of the political economy to be working together. Government needs to lead, government needs to provide standards and regulation, the private sector needs to play its role in adding the micronutrients, ensuring the quality and distributing fortified products. Civil society and academia need to be providing the evidence, providing the monitoring. So it does require the whole system to work together. And that makes it also a very unique intervention. And I think when we talk about today about multi-stakeholder partnerships to deliver public goods, large-scale stable food fortification is one of the first and most successful of those. And we had that for the last 25 years or so. And I think the economic benefits of fortification are well documented. The World Bank estimates that just adding iron into staple foods and iodizing salt each year would provide at least $7 to $8 billion benefit in terms of improved productivity and healthcare benefits. What we've seen, from our work in GAIN, where we've been leading in this area for the last 12 years, some real good results that are coming out, and this is something that we're going to see a lot more of. But we do see, for example, in Indonesia from oil fortification, some improved vitamin A status in adults and children. We've seen in South Africa from fortification of wheat and maize flour, particularly with folic acid, some dramatic drops in neural birth defects. But we've seen also in places like China from the iodization of salt, the virtual elimination of iodine deficiency disorders over the coming years. And I think we're going to see more and more evidence coming out around the impacts as many of the programs are starting to really work at scale in an effective way. And I think that's one of the other things that we've learned is that these programs on average take 10 years to actually be fully functioning when all the factors are in place. We're going to hear a little bit more about a case later about Bangladesh, which will give some example of how it's one thing to have a great intervention that you think will have a public health impact. It's another thing to try and implement it at scale. And I think you'll be excited to hear about that. The problem we have today, though, is that we have, I think, over the last dozen years or so, been able to make significant progress. We're looking at salt iodization today. We have 150 countries that are implementing large-scale programs, but there's still about 26 countries where iodine status is described as inadequate. When we look at salt and salt, this is a 30-year program that again, a lot of people thought the job was done. And I think we've done a lot of work, but we still have a significant amount of work to do, and particularly something that GAIN and UNICEF have been working on a lot is reaching the last mile, the hardest to reach. We're often the most efficient, and I think we've made some progress, but we're still struggling to reach the last 20% of those people. Similarly, if we're looking at mandatory fortification of wheat flour or maize flour with micronutrients, we have about 81 countries that have introduced regulations. But what we've seen in many of those countries is that still there's a long way to go to get the fortified products fortified to the extent they need to be, at the quality they need to be. But we also have quite a number of other countries which still haven't moved forward on regulations. And I think in many places, and I think we'll hear this in Bangladesh, it's not straightforward to get manufacturers to move forward on this agenda. So we still have a lot of work to do, and I think one of the things that we've seen in the nutrition sector is, well, nutrition has gotten a lot more attention. A lot of the focus shifted over the last 5 or 6 years to, focusing really on targeted interventions aimed at the 1,000-day window, which is where we've all put most of our efforts. But I think what has happened is that we've kind of lost the focus on population-based initiatives that do have an impact on the 1,000 days, but also have an important impact on adolescent girls, women of reproductive age who are not in the 1,000-day window, and that we need to actually reinvigorate and build new interest and awareness that fortification is one of the most effective interventions we have. It is one of the most cost-effective. We need to actually do a push over the next 10 years to actually make sure that in most of the countries where people are suffering from malnutrition, that fortification is a basic pillar of the food system. And it's regulated and it's monitored, and we're looking at the impacts on an ongoing basis. So we need to really step up and build that commitment to finish the job on fortification. So today I'm really excited to be with our partners, some of them who are here today, launching a new campaign called Future Fortified, which is really a major effort of the partners to build new interest and support around fortification. This campaign links very much to a global summit on fortification, which is being co-hosted by GAIN and the government of Tanzania, which is really, and also involves key partners such as USAID, the Bill and Melinda Gates Foundation, WHO program, UNICEF, African Union, and many others, who are all coming together to share the experience, share what's worked, what's not worked, and really look to the future to say, well, as we design a strategy for the next 10 years, what does it look like? How do we get impacts? Let's not wait another 10 years, to build slowly as we have. We want to move much more quickly than we have. So this summit will happen in September. And it's really a key moment where the international community takes stock and comes forward with a new plan. So today is a bit of a start of that conversation here, and I'm really happy that we're coming together to have this discussion in the context of the World Health Assembly. Before we start with our first speaker, just a point on housekeeping. We'll be live tweeting some of the comments from the session. If you'd like to join the conversation, you can do so by using the hashtag FutureFortified in one word. Let me turn to our first speaker, Francesco Branca, who's the Director of Nutrition and Health at the World Health Assembly. Many of you know Francesco. He has been really critical to moving forward the whole nutrition agenda into the global platforms that we are today. I think many of us were watching as these targets got created and scratching our heads, wondering what